Welcome to Medicare Help Group, a quick guide for your Medicare queries. Let Medicare Help Group assist your needs. And so today we will be talking about which drugs are covered on Medicare Part D. So each plan has its own formulary, and drugs are placed in different tiers on their formularies. Drugs in each tier have different costs. Those who are in the lower tiers will generally cost less than a drug in a higher tier. But if your drug is in a higher tier and your prescriber thinks you need it more than that of in a lower tier, you or your prescriber can ask your plan for an exception. Formularies can change by the plan. Your plan will notify you of any changes. So, important thing to remember. Each month that you will fill a prescription, your drug plan mails you an explanation of benefits notice or EOB. Review your notice and check for any mistakes. Coverage rules for certain drugs. Number 1 is prior authorization. You and/or your prescriber must contact the drug plan before you can fill certain prescriptions. Your prescriber should prove that the drug is medically necessary for the plan to cover it. Plans may also use prior authorization when they cover a medication for certain medical conditions, but not all medical conditions for which a drug is approved. If this happens, it will likely that plan will have alternative medications on their formulary for the other medical conditions for which the drug can be described. Second is the quantity limit. They will limit how much medication you can get at a time. Step therapy. In most cases, you must try one or more similar, lower-cost drugs before the plan will cover the prescribed medicine. Prescription safety checks at the pharmacy, which includes opioid pain medication. Before your prescriptions are filled, your Medicare drug plan and pharmacy perform additional safety checks, like checking for drug interactions and incorrect dosages. These checks also include checking for possible unsafe amounts of opioids, limiting the day's supply of a prescribed opioid, and use of opioids at the same time as benzodiazepines, which are commonly used for anxiety and sleep. Opioid medications used for pain like oxycodone can help with certain types of pain, but they do have serious risks like addiction, overdose, and death. These risks are increased when opioids are taken with certain other medications, thus it is very important to be checked first before being dispensed. Drug Management Program. These are programs in place for some Medicare drug plan. This will help you use the medication safely, especially for opioids and benzodiazepines. If you get opioids from multiple doctors or pharmacies, your plan will contact the doctors who prescribe these drugs to make sure they're medically necessary and that you're using it appropriately. If your Medicare drug plan decides that your use of prescription opioids and benzodiazepines or any kind of drug may not be safe, the plan will send you a letter in advance. This letter will tell you if the plan will limit coverage of these drugs for you, or if you'll be required to get the prescriptions for these drugs only from a doctor or pharmacy that you select. The opioid safety reviews at the pharmacy and the drug management programs generally don't apply to you if you have cancer, getting palliative or end-of-life care, you're in hospice, or reside in a long-term care facility. If you or your prescriber believe that one of these coverage rules should be waived, you can ask for an exception. Do you get automatic prescription refills in the mail? Some people with Medicare get their prescription drugs by using an automatic refill service that automatically delivers prescription drugs when they're about to run out. To make sure you still need a prescription before they send you a refill, prescription drug plans may offer a voluntary auto-ship program. Contact your plan for more information. Medication Therapy Management Program, or MTM. These are additional services offered to plan members who have Medicare prescription drug coverage. Members who qualify can get these MTM services to help them understand how to manage their medications and use them safely. The MTM services offered may vary in some plans. They are usually free and include a discussion with a pharmacist or healthcare provider to review your medications. The pharmacist or healthcare provider may talk with you about how well your medications are working, whether your medications have side effects, if there might be interactions between drugs you're taking, and other problems you're having. For more information, you may email us at hello@medicarehelpgroup.com or contact us at 925-732-2845. That's it. Thank you for watching. Don't forget to hit like and subscribe for more helpful videos on Medicare.